Accept my humble regards and hearty namaskar in the series of patient's journey from crisis to recovery. This is another patient with a longer admission in ICU, a true story of resilience, I would say, of the family members, of course, the ICU teamwork, the faith the family had in the ICU team, and finally the hope. This was a 60-year-old male admitted to our ICU in April end with a blood pressure of 170 by 100, weakness in left part of the body, upper limb and lower limb, and slurring of speech. CT scan revealed the bleed, right side capsulothalamic bleed. On routine investigations, platelets were low, just 50,000. And in serum protein, serum albumin was just 2. In the detailed history, patient gave the past history of CVA in 2019 too. He was a known hypertensive for more than 10 years on irregular antihypertensive treatment. And since 6 months, he had stopped the medication for high blood pressure and switched to Ayurvedic treatment. So why this video is very important? Because recently on 17th May, there was the World Hypertension Day, and there were many videos floating on the social media for the awareness. I see in my day-to-day practice, not only me, many of my colleagues must be seeing this, that high blood pressure, hypertension, such a common entity, but it is neglected the most. And once neglected, it causes a havoc in the body. Another myth, I will say, or another narratives which are on the social medias are that for the high blood pressure and diabetes, these allopathic medicines are not good. Ayurvedic and homeopathic medicines are better. So majority of the patients, I would say 80% of the patients, they stop their medication on blood pressure and diabetes and they switch over to Ayurveda or homeopath. Then after many months, when they get serious, they get admitted to ICU directly. So this was the case with this patient also, as he had stopped all medications in spite of having 2 episodes of stroke. He was on Ayurveda medicines, and family members told that he had reduced his diets a lot and he was taking certain herbal products, which even the family members were not sure. Patient used to say that he feels very light and good and his appetite had gone down, and family members used to feel that he is becoming weak. So this happened as the BP rose, he had shot up, he had a bleed in his head. So the neurosurgeon did the extraventricular drain is put inside the brain, and patient was maintaining the conscious level after the EVD. This patient was in ICU with very good intensive care and monitoring of the GCS and vitals. Then on the 7th day, this patient developed continuous fever. In the X-ray, pneumonitis patch had developed. So the patient had to be intubated, taken on ventilator, central line was put, vasopressors were started. So the treatment of severe sepsis was initiated. Cultures were sent. We call it pan culture, culture of the blood, culture of the urine, and culture from the endotracheal secretions. First culture reports, all the culture reports came normal, but the patient was serious and was having fever. So the antibiotics were upgraded. As it was anticipated that patient will take long on ventilator. So on the 4th day, elective tracheostomy was done. Then with repeat cultures were sent, and it was a long course with many ups and downs of the fever episodes. To the certain antibiotics, the patient would respond and patient would become afebrile for a few days. And again, he would start having high-grade fever. Platelets, which were initially 50,000, those also remained around 60, 70, 80,000. The cause of low platelets was not known to the family. Low serum albumin, just 2. So this shows that the nutritional status of the patient was really very poor since few months. So it was difficult, not only difficult, with lot of ups and downs. The treatment continued. Eventually, patient was weaned off ventilator. The patient on tracheostomy tube shifted to ward. Now the patient has become, when the patient became afebrile, now the patient has gone into rehab. Now, this is again sharing of the purpose of sharing is not only for the public, it is for medical community also. The message to the public is, do not take hypertension, increased blood pressure lightly. Please follow your doctor for medications. I've seen many patients, they say, we just check the blood pressure. If the reading is high, we take the medicine. If the reading is normal, we do not take the medicine. So this is not the way. Adding on Ayurveda and homeopath, it's your own decision. But stopping allopathic treatment and moving on to that is not at all intelligent. And message to the medical fraternity, do not lose hope. Once the patient comes to ICU, there are many doctors from different specialties who are not intensivists. Even they feel that once the patient has gone on ventilator, now this is the last stage and patient will not make. It is not so. I can share with you hundreds, thousands of patients for whom ventilator has been a lifesaver. There is a video I will put in the description box on in my YouTube channel. On my YouTube channel, few videos on ventilator myths and facts, ventilator a death sentence, or ventilator a life saver. So with this, I will end the video and I will share more cases with you in this series of journey from crisis to recovery. Thank you so much.